We're here, just completed our consensus conference on handoffs, and we're here with the co-chairs, Dr. Meghan Lane-Fall and Dr. Jeffrey Cooper. We'd like to just get an idea of how this conference came about. Dr. Lane-Fall, do you want to chime in on that question?
Sure. So the conference really was the brainchild of the Multi-Center Handover Collaborative, which is a group of people who are largely based at academic institutions who are interested in improving handoffs in perioperative care. And there were a group of us who thought, well, how can we start to do that? Should we develop an implementation toolkit? Should we think about developing a research collaborative? And those of us who were present at the last year's APSF meeting in 2016 said, well, this is a great venue to have a really meaningful multi-stakeholder conversation about handoffs. So maybe the APSF would let us take over their meeting. So we engaged the help of Dr. Cooper, who pitched the idea to the board, who said, yes, let's do it, and the rest, I think, is history.
Fantastic. And Dr. Cooper, you've had over 4 decades of knowledge and research in this particular field. What do you take home from the stuff that we talked about today in terms of the consensus conference?
As I mentioned in my talk, probably 35 years ago or more, our research showed there was an issue around handoffs, particularly those intraoperatively, and we tried to implement change and were frustrated. I think because my naivete in implementation science, to put it very simply. And I think what we took away from this conference is a set of guidance information for those who really want to implement improved handoffs. It's really tough to know what to do. There's so much literature. And I think what we put together here is this consensus from just about 100 people about what they generally agree are the right things to do if you want to improve handoffs. So I think there's going to be some really useful information here for people.
Thank you very much. And please stay tuned to the October 2017 issue regarding handoffs and perioperative transitions of care. There will be a handful of articles with the experts weighing in on some elements of transitions of care. Thanks so much.